Mr. Luxon on breakfast this morning. Question from Jenny May, exactly as you've just heard from Ayesha Verrill. Overspending or underfunding?
Comes for New Zealanders.
You're calling these changes as a result of an overspend. Or is this more of a case of underinvestment or underfunding?
No, what I want to say to everybody is, health today in New Zealand, we spend about $30 billion every...
So this is the answer where his response is, are you underfunding it? No, because we've never spent more. Okay, that doesn't mean it's not being underfunded. If I've got a mortgage and my mortgage is $1,000 a week, and last year I was paying $700 a week, and now I'm paying $800 a week, I've never paid more towards my mortgage, but we're still going backwards $200 a week. That's not an answer to is it underfunded, but it's the answer that he's going to give.
Say to everybody is, health today in New Zealand, we spend about $30 billion every year on healthcare. And in addition, in the budget, as we've talked before, we put in an extra $16.7 billion over the next 4 years. So we've got record amounts of money going into health. I want to make sure that as I put taxpayers' money into healthcare, I'm actually putting it into a really high quality organisation that's going to deliver the outcomes that I'm expecting to get for that money.
Yeah, and that'll take time.
Well, that's why we've put a commissioner in, so they can move with great speed.
Yep.
Again, there's a lot of focus on speed. That doesn't also necessitate, doing the job well. Most of the times when we want a job done well, we don't move with huge amounts of speed. These guys are talking about, and every answer they give, not necessarily in this conversation, it's always about hitting budgets and doing it quickly. They very rarely talk about doing it properly, no matter how long it takes. And I mean, we were talking last night, Chewy, and I was listening back to a clip today because I was editing it, and you said something about the American election, that it'd be nice to have a nice boring, series of politicians in just to run the country. It's like, yeah, boring politicians will do things right, even if it takes a long amount of time. These guys are about moving fast and hitting budgets and slash and burn. So again, what he just said, a commissioner in place to move quickly. Why? Do it well. Measure twice, cut once. These guys aren't measuring at all, and they're cutting straight away, Chewy.
It's move fast and break things.
Yeah.
Which is a great analogy if you're talking about the corporate world and agile and all of that sort of stuff. It's less good when you're talking about people's healthcare.
Yeah.
And I think, again, it comes back to that whole thing of equal care. Everybody gets treated the same. That sort of thing. We know it's not going to work.
Yeah.
It's exactly right. You're spending a whole bunch of money, but what are we getting for the money? And the question that should go along with this, with his backhanded fucking comment about, I want to make sure it's going into a top organization, as if Health NZ is not a top organization. That Te Whātua Ora is this rickety shambles of bloated government spending, which it isn't. It just isn't.
Yeah.
Our population's expanding. If it was bloated, we'd have nurses standing around scratching their bums because they had nothing to do.
Yep.
The doctor's car park full of Bugattis. We don't have that. And if his answer is to run this down and privatize it, like I think they want to, because the health minister is involved in private healthcare. The guy that they've just appointed is a huge fan of private healthcare. And these guys have been reading the Tories' notes as they dismantled the NHS and made it an ineffective shell of what it once was. And these guys think that's a great idea.
Yes, indeed. All right, we'll keep going.
Yeah, and that'll take
well,
time.
That's why we've put a commissioner in, so they can move with great speed.
Yep. So, in saying that, though, Health New Zealand was already taking measures to limit spending, right? Public hospitals were told to cut back at around about $105 million by July. That included roles not being filled. Is that not a sign of underfunding?
No, I disagree, Jenny May. Just so you're really clear, the funding is record levels. We've never had this amount of investment in health.
This is the talking point. right? PR agency has got them to say, just remind them how much we're spending. That's all you got to say. Remind them how much you're spending. Jenny May has another question.
Number.
Yeah, answer big number.
You know, just so you're really clear, the funding is record levels. We've never had this amount of investment in health in New Zealand.
And last year's funding was record levels, and the year before that was record levels, and next year is going to be record levels because it goes up every year.
Ever. And we were able to do that by making savings across public services in the budget. The second thing I'd say to you is we've got a massive focus and a drive on recruiting frontline staff. And what this is about is saying, look, there's 2,500 extra managers that have been put into Health New Zealand. There is 14 layers of management between the patient and the CEO. If you're a frontline doctor or nurse, go talk to them and talk about the challenges that they've got dealing with management mush that sits above them. And so this is what this is about, is making sure that organisations set for...
I get a feeling that was brainstormed as well. Management mush. Mark this one, management mush. See how much you hear that this week.
Purpose. It's focused on the front line. It's focused on those outcomes. We now have 2,900 extra nurses in the healthcare system.
Oh, when did they go through the education sector, I wonder? I wonder who they graduated under, because there's an extra 2,900 this year. Wonder when do they start doing it with a free first year of education? I wonder when. I wonder if these guys will take credit for them.
Over the last year. A lot of that's come through in the last 6 months under our government. We've got more nurses in our system than we've ever had before. Yes, there's now more nurses needed in mental health, critical care in some of the regions, and that will continue.
No, that's it. We're cutting through it because that's the BS level. See, we have to come out every couple of minutes to get rid of the BS. Got to shake it out of the sides of your head.
Jesus.
That's fantastic. That it's like 2,900 extra nurses, many of which came through in the last 6 months. Yeah, but it's a 3-year course, numbnuts. When do you think they were studying? Not under you. You're taking credit for Labour's advancement of nurses. Good on you. All right, Chewy, you want to get in there? We've got a couple more to play.
No, let's push on.
Let's push on. The thing about the 14 layers is interesting. She actually asks them directly, and I've got that clip coming up shortly. Right now, though, we're going to have Jenny May talk about Rob Campbell. Rob Campbell, who they have on earlier. You can see how this is a very long clip. The first half of this clip down here is actually Jenny May talking to Rob Campbell. That's Rob Campbell there. And they replay a piece of the conversation to the Prime Minister that Rob Campbell say. Rob Campbell was formerly the Health New Zealand chair. And they were talking about, are costs the issue or not when it comes to the health system?
Former Health New Zealand chair, Rob Campbell, who joined us this morning. You'll know him. He was in charge between 2021 through to February 2023. Now, as I say, he spoke with us on breakfast this morning. He talked about costs not necessarily being the issue, right? That it's actually about a good health system. Just take a listen to what he told me this morning.
You can't get a good health system while you are walking backwards on tobacco control, while you're walking backwards on alcohol control, while you're walking backwards on speeds on roads, while you're underfunding the GP sector, which is so critical to our system. While all those things are happening, it doesn't matter what you do in the leadership of Te Whatu Ora. You won't achieve a better health system. They're in the wrong place.
He says they're in the wrong place in terms of the focus. Is he right?
I disagree with him completely.
Funny that. And what about the dismissive laugh? That was in there as well. It's funny. He disagrees completely. The guy who ran the area that you're talking about for 3 years, the guy who had to go through a previous government and into your government about how it should be run, he's completely wrong. And the guy who sold deodorant for several years is the one who's correct.
Focus. Is he right?
I disagree with him completely. What we're doing as a government is being very clear about healthcare. We're putting more money than we've ever had into it before. We're recruiting more frontline staff than we've ever had before.
And what he's alluding to is the rollback on all of these policies. I mean, you'll actually have more people actually turning up at hospitals that'll need greater health care.
Yeah.
I disagree completely, Jenny May.
That's a good disagree. I'm glad he disagreed with that, because Jenny May's put a measurable thing out there. There will be more people turning up to hospitals. I disagree, Jenny. I disagree. He's making a prediction. He's saying fewer people turning up to hospitals. We can mark this date. That's a measurable comment he's made. One of several he's only made in this whole time.
Greater health care.
I disagree completely, Jenny May. I disagree completely, and I appreciate, he was part of a previous administration and had a responsibility as chair of the Health New Zealand board. And I've agreed with some of the things actually that Rob has
Labor
identified,
bad,
which is, I think as a government we need to give maximum clarity to that board. In this case, now a commissioner. The commissioner will then deal with the organisation and obviously the management of the organisation as well. But it's important. We have to deliver improved health outcomes for all New Zealanders, and that's what this is about. We've put the money in. I want to make sure that the money's going into a very good organisation that's well managed, that's expertly managed to get those improved outcomes.
Clip number 2, Chewy. Yours, sir.
He's doing that by sacking a board and demanding that they make 1.4 billion dollars worth of savings.
Yeah.
And just basically making the assumption that the whole health sector has so much fat in it that they can just get rid of management mush and this perception that there are too many managers somehow in a hospital. That's going to work. And I'm sorry, if you're a supporter of National, you probably wandered into the wrong podcast. But if you are,
welcome, Haere mai. Welcome. Haere mai means welcome. Means you might know that if you're a Haere mai. Come.
If you are a supporter of National, what you need to do is realise that he is taking you for a fool.
Yeah,
he is banking on the fact that you are too simple to look at something like a hospital and a whole nationwide organisation that delivers socialised health to its citizens can just do it on a handful of managers. And that there's so many managers getting such huge wages that they can make $1.4 billion worth of cuts and not touch the front line, and you're going to get seen by a doctor quicker. Yeah, and there's not going to be people getting double bunked or put on gurneys in the hallways, and you're not going to have nurses burning out or junior doctors burning out and leaving the country. That it's all going to come out of somebody sitting in a desk in an office somewhere in the middle of the hospital.
Or ambulances sitting in the car park so they don't have to start the time on how long people are waiting for with patients inside, or on and on and on and on and on and on and on.
That is laughable. It is laughable that he expects people to believe this. Some people will.
Well, it's not that even that they actually this is the thing. It's not that even what he's saying will be untrue, because they will just wipe out the whole back room area, right? The back office, because he's not saying we'll get rid of the back office and it won't impact the front line. So they'll get that they could be accurate and do what they've said by knocking out the back office, and it could make it a whole lot worse. Still doing what they said they'd do. We told you we would, and you put us in. We've got a mandate. I just think that the inflection from what he's saying is, and everything will be operating better. The example I gave to Isha Viral about, the receptionist and the caretaker in every school are the most valuable people, because they're the ones the teachers rely on the most to do their stuff outside of class time and to clean up when the kids vomit in the classroom. And they're backroom people, and they're probably the most valuable people in a school.
I mean, anybody that's worked in an organisation knows that the office lady is the thing that holds the whole fucking thing together and makes sure that everybody gets paid. Yeah. That is a back roll position.
Yeah.
It's the person that gets the invoices paid. And Luxon should know that if he worked in business. But somehow I don't think that Luxon's someone that shares a break room with the office lady and payroll.
I read somewhere that he this is what I've read. I'm not saying it's accurate. It'd be interesting to find out, or someone can put in the chat the link if it is, that he fired 20,000 people from Unilever when he was there. They let go of a whole bunch of people. That was the response to making it more. Because of course, the way you make something more profitable is you either do things better, you build a better widget, you become better, or you just get rid of a whole heap of your overheads. And salaries are always the biggest overhead to make that profit margin bigger.
You might be shocked about this, Pat, but that's also what happened when he was at Air New Zealand. Like, all he had to do was basically just hold fast, and it would have kept on going. Air New Zealand was award-winning. But he cut costs because it delivers value to shareholders. And that's the thing that gets him his bonus. They were never people. They were units that took away from profit.
Yeah. All right. Now, Sarah's jumped ahead of the next little short clip. It's only 90 seconds, but the 14 layers doesn't get delved into very deeply here. But Jenny May makes it clear that that they've been trying to find out from anyone, the health minister, whoever it is, what the hell these 14 layers are. And nobody will give them any answers. So TVNZ can't find out what they are. The Office of the Health Minister hasn't told them what they are. So my bullshit nerve's going off just a little bit between me and you. Unless when they talk about 14 layers, what they're talking about is person, layer 1, gets in their Uber, layer 2, goes through the front door and gets a coffee. So the person in the cafe is layer 3. Then, what are they? Tell us what they are. Let's see what these guys talk about.
I do want to move on, but I just do want to make the point that we asked the Minister's Office for the chart of those 14 levels. They said it would take longer than up to this interview to gather that kind of information, which, seems...
So hang on. So there's 14 layers, which means you've worked out what the 14 layers are, but you say that you are needing time to get together what the 14 layers are to pass them on to TVNZ. You've already identified them because there's 14. They should be in a list in an email from Shane to Christopher. Here's the 14 layers. I smell bullshit, Joey. I smell bullshit.
They said it would take longer than up to this interview to gather that kind of information, which, seems a bit odd, given that this was something that you pointed to yesterday. You wanted those 14 levels reduced down to 6, and given the urgency of these reforms. But I guess for people watching this interview this morning, Prime Minister, when will the frontline services, therefore, when will people who are seeking health care see a difference with the changes that you have made to the health care that they will get? What is the timeline?
Yep, metric, please.
Well, the first thing, Jenny May, as we talked about in opposition, is it's about workforce. We're recruiting more frontline doctors and nurses than we have in a long time. We've got a record number of nurses in the system. The second thing's been about the funding. We've put a record number of funding in. There's $30 billion.
But we're looking for a date.
Year,
when's this going to kick in and benefit us?
Going in, plus the new cancer drugs that we've put in place with Pharmac as well. So there's huge investment going in, and we've put targets in place, 5 clear health outcome targets that New Zealanders care about. Now what we're doing is making sure the organisation can deliver against all of that, and that we actually start to see those improved outcomes. That's why we've put a commissioner in place for 12 months so they can move with great speed and really accelerate the decision making. It needs a big turnaround. It needs to get sorted, and that's what the commissioner will do.
But
no answer.
What?
No answer.
Give Jenny May an air horn. or just no. We're 3 sentences in. No, nothing. Start again. Yeah. Do not pass go. Do not collect $200. Did not answer the question. Straight to jail. I know politicians have a reputation for this. But what we saw yesterday with the laughably named climate minister, what we're seeing here with Luxon, is just such egregious levels of taking the piss and talking for as long as possible without actually answering the question.
Yeah, no question answered.
It's beyond a joke.
Yeah.
Call them on it. Where's the answer? Is that an answer, Mr. Luxon? Would you like to hear the question again?
When are we going to see it? When?
Would you like to phone a friend? Would you like to get one of the 7 layers of social media management to answer the question for you? Is that it?